Hi, Prof. I'm Sallie Lamb. I'm the Provost Chancellor of Health and Life Sciences at the University of Exeter, and I'm a physiotherapist and statistician by background. Yeah, why did I become a physio? Mostly because my mother was a physio and I was kind of forced to become a physio because I didn't have a terribly conventional time at school. So yes, I was rather pushed into it. I'm proud of actually many things now that I look back. I probably didn't at the time kind of appreciate them as well when I was actually doing them. But I'm particularly proud of some of the early work that I did in understanding targets for rehabilitation after hip fracture, in particular the role of muscle power and muscle strength and balance. So that was a piece of work that I thought was quite creative. So I enjoy doing creative work. And then, of course, I've done a number of large clinical trials. And I think the most significant of those would be the back skills training trial, which I think has been a trial that's helped to change the narrative on how we approach low back pain and how we think about it. The strengthening and stretching for rheumatoid arthritis of the hand trial, which demonstrated something that probably many of us already know, that hand exercises are effective in the management of rheumatoid arthritis. But the evidence was needed, and that trial provided that and also showed that was very cost-effective treatment. And we've been able to disseminate a very effective package to physiotherapists across the world. More recently, I particularly like the better outcomes for spinal trouble for older people study that we've been doing. That's a series of epidemiological and clinical trials where we've been focusing around spinal stenosis and some of the more severe forms of back pain in older people. And that's fused my interests in geriatrics with my expertise in musculoskeletal. So I've really enjoyed that piece of work as well. I've loved all my clinical trials and all the studies. They each come with their own challenges. They each teach you something new. And I've worked with some fantastic teams of people, both in the clinical setting and in the academic setting over the years to get those trials done. So it's been a real pleasure. Actually, what I have seen is perhaps changes in the management around physiotherapy. So a really striking change for me is the change in the management of rheumatoid arthritis. Anti-TNF therapies came along and have pretty much revolutionized, although not cured, rheumatoid arthritis. They have really changed the expression of the disease. So I suppose that might sound like a strange thing to pick, but when I first started my clinical career, rheumatoid arthritis was a life sentence. I mean, it really was. It is still a terrible disease, but the management is so much better. And really, in those days, physio was one of the, kind of very few treatment options for people. And it was a very difficult and very painful process for people to go through. That sticks absolutely in my mind. And I think the combination of improved physiotherapy and improved drug management has really revolutionized the management of rheumatoid arthritis. So I think there's lots of examples, but I'll pick that one out. And I'll kind of pick it out because it's actually a combination of different influences that have kind of revolutionized the physio management in that situation. Yeah, I think that I would try to seek out inspirational people to work with. I have come across people in my clinical experience who were truly inspirational clinicians. They really understood how the body works and functions, and they were able to create treatment packages that I thought were, they really were able to create excellent interventions based on their kind of very firm knowledge of biomechanics, anatomy, etc., etc. So I really would seek out inspirational people because it can be a very hard job doing physiotherapy, and I think it's really important to keep your motivation up, to keep your interest up, to keep reading and wanting to learn. And I think those inspirational people around you will really help you to keep that level of interest and progress the profession. Curious people create new solutions to things. And, you know, if you can keep that curiosity going, I think it's critical. And I think what I've also learned is that it takes many people to bring their curiosity to a problem, to create a solution. So you need academics to work with curious clinicians, to work with curious patients as well, people who really, you know, engage with wanting to make things better, and through their different perspectives, you know, can kind of create new solutions to problems. And I think that power of bringing those things together is really important. So keep curious and keep collaborating. I think that very much depends on which country you live in. Maybe all of the countries will move into one direction, but certainly in the UK, decreasing the length of stay in secondary care has meant that access to physiotherapy has decreased, I would say. We do have community services, but increasingly we're having to find new ways to manage people's help people to manage their conditions on less time. So whether it be online, whether it be shorter, more intense treatment packages, a greater shift towards self-management. I see that very much driving the agenda in the UK. And it's interesting when I talk to Australian colleagues where funding for physio is a bit different, the kind of more traditional way of delivering physiotherapy still exists, so a substantial amount of face-to-face contact. So I can see it changing in that way. I think we must keep up our real success in the scientific community. So we have been extremely successful in establishing our research kudos. And with that, you know, kind of the respect that other professions have for us and for our practice. So we must continue to do that. And I think there's no reason why we won't do. Some of the answer is in your question, actually. I mean, community is really important, and physiotherapists form a great community. So I'm sure many people will kind of get it when I say you always know somebody somewhere. Or you know somebody who knows somebody else. So we have a great community of practitioners, and I think that's the first thing I like about PEDro. It's, you know, focused in to our community, and it's selecting evidence that's appropriate to our community. So that's the first thing. I think the second thing that's really important about PEDro, the evidence base is becoming ever increasingly large. It's now huge, and it's difficult if you go into PubMed. It can be very difficult to do these literature searches. The literature is becoming more complex, and it will continue to do so as new methods are integrated into the scientific approach. And it can be difficult to really understand the quality of articles. And I think PEDro does a great job of sifting what's relevant to physiotherapy and providing that quality appraisal for physiotherapists. So I think people can be confident in the integrity of the papers that they're reading. And it's a really good way to keep on top of the literature.